am the face of Black maternal health. My name is Aryana, and I have a beautiful baby boy. When my husband and I started ideating about starting our family, it was around the time that I had my first annual appointment with my OBGYN, and I started to ask them family planning questions, to ask them about my health, family history, if there were any concerns there. And they said, no, you're young, you're healthy. Why don't we, when you're really ready to start in earnest, we can start to have more discussions and answer whatever questions that you have. I think about a month after that discussion, I was pregnant.
Well, first of all, congratulations to Aryana for utilizing her annual appointment with her OBGYN to discuss her health and her family's health history prior to starting her family. Preconception counseling visits are very important because it's almost like a tune-up for the patient before she decides to get pregnant. It helps us identify risk factors that could potentially become a problem when she actually became pregnant.
I think that might have been a missed opportunity to have a fruitful discussion concerning family history. There might be something in the family history that could potentially impact her pregnancy. I think it was a good idea for her to bring up the fact that she was interested in having preconceptual counseling. You never know when she may or may not get pregnant, whether she's deliberately trying or not. So I think that might have been a great opportunity to have a fruitful discussion.
The American College of Nurse Midwives, ACNM, supports the reproductive justice framework. Therefore, midwives would be encouraged to counsel Aryana through the reproductive justice sensitivity counseling framework. The PATH system, for example, would look at questions concerning when she'd want to get pregnant, what time would she want the pregnancy to happen, how important it is for her to get pregnant, and the like.
When should women go for preconception counseling? This is a question I get asked quite often, and I think it's important that we maybe reframe the word preconception counseling to more probably healthcare counseling. Why do I say that? Well, we know that the earlier we have optimized health, the less likely we're going to have risk factors during the pregnancy. And this is where even our pediatric colleagues talking and honing in on the importance of overall cardiac health could make a difference.
Pediatrics plays a role in this Black maternal health crisis. We found that a third of adults with hypertension, high blood pressure, they happen to be children of moms that had preeclampsia, and children born to preeclamptic moms have a higher risk of obesity and high blood pressure. So this Black maternal health crisis is a whole spectrum, not solely focused on the pregnant mom and thereafter. It's a lifespan issue that we need to take seriously and address from the very beginning and the very end as well. Key word is preconception, and as a pediatric specialist, I tell people that in this Black maternal health crisis, we first have to remember that Black mothers are first Black girls. So as such, the counseling should begin early on. We should be teaching our Black girls the importance of good heart health.
I did not have a birth plan at the time. I was a registered nurse and a mother of 5. So I thought I was well prepared already. I had been through this 5 other times before with no issues.
Are the Faces campaign aims to provide tools for both patients and clinicians, enabling Black women and their families effectively navigate the maternal healthcare system and engage in important discussions. The infographics outline essential questions to ask clinicians at every stage of the maternal health journey, starting from preconception to post-delivery.